Reforming the American healthcare system is a hot topic on the campaign trail, in government, and around the dinner table. Can this broken system be fixed? Dr. Robert McLean is the president of the American College of Physicians, and Robert Daugherty is the senior vice president of governmental affairs and policy for the AHCP. Welcome to you both. Dr. McLean, I'll start with you.
Well, thanks.
What has prompted the American College of Physicians to issue this bold call?
Well, we recognize that there is just too big a problem with our patients not having adequate affordability and accessibility for health care. And that has driven much of what we are talking about here this morning.
In Indiana, for example, 8.3% of people are uninsured, and 18% of adults in Indiana have no usual source of care. That means they don't have a doctor like Dr. McLean to help them manage their care and get the care they need. And that is shockingly too high.
You know, as far as the affordability goes, I'm in practice in Connecticut, and I see patients every week who have grave concerns that they express to me about their inability to afford co-payments for prescription drugs, for office visits. High deductibles are increasing for things like tests, and so it's a real problem. Even people who have insurance have real problems with the affordability of various aspects of their health care.
Well, what steps have you rolled out to begin to fix this system systematically, if you will?
Right. Well, so the background is, so the ACP said, listen, we know that we can do better. And so we decided to do what we do, which is evidence-based reviews. So we looked, we had the goal of what does it take to get us to a healthcare system that has universal access, that protects people who have pre-existing conditions, and that simplifies the huge administrative burden that currently exists in our current system. And so we looked at what does the evidence show works and what does not work. And so we looked at states across the country, many of which have put in place state-based systems. We looked at countries across the world and what they have in place, and we analyzed that, and that evidence made us come to the conclusions that we have in these papers.
We are so excited to be the first National Physician Specialty Society to recommend that the United States adopt either a public plan for everybody, often called single payer, or Medicare for all, or alternatively, at least give everybody the option of enrolling in a public plan, or they can keep their private insurance if their private insurance covers at least the same amount of care. Both approaches, we think, could get everybody access to affordable coverage. And we also are saying deductibles should be eliminated for high-value care like primary care. We think there should be no deductibles if you have a chronic illness, because those deductibles stand in the way of getting the care that you need. And we also recommend ways to bring down the excessive pricing of many services, including prescription drugs.
You know, healthcare is not a commodity. In many aspects of the current system, still treated as a commodity. And those of us who treat patients every day and see the struggles people have realize we're treating it in a wrong way, and we need to look at it from a different approach. And that's a lot of what we're talking about here.
And what are you up against? I mean, we've heard about health care as a hot topic, single payer, Medicare for all the things you mentioned. What's standing between you and having this plan realized?
Well, I think a lot of it is actually kind of oversimplification. These are complicated issues. It's kind of tiresome to hear a lot of complicated healthcare issues be kind of sloughed off as rhetoric on the campaign trail. These things cannot be understood with one or two sentences on a stump speech. And so we have a lot of things to say, and they're all very important, and they're meaningful to everyone.
Well, I mean, one of the things that we are rejecting is the conventional wisdom that the politics are too hard, or we're too divided as a country. Because if you say that, then you're being forced to accept the unacceptable. And to us, it's unacceptable that millions of Americans do not have access to affordable care. If we have enough physicians and enough patients stand up and say better is possible, we believe we can achieve a better healthcare system for all. And our recommendations, I think, point the way to get there.
Thank you both so much for all this excellent information.
Well, we hope people will go to our website, which is acponline.org. There are links to these papers, and we really hope people read them, understand this, really put pressure on their legislators and elected officials to treat healthcare as not a commodity. We need action, and we really want everyone's help. Thank you.
Thank you so much.